Hey nurses, welcome back to my YouTube channel. This is Tosin, and this video is a step-by-step guide on how to stay organized in nursing school. One of the biggest reasons nursing students feel overwhelmed is not always the difficulty of the material. It's the fact that everything is happening at the same time. You have lectures, you have exam, you have clinical rotations, assignments, care plan, and hundreds of pages of information to study. Without a system to stay organized, it can quickly feel chaotic. So in this video, I'm going to walk you through how I stayed organized and manage everything during nursing school. Hi everybody, my name is Tosin and I am an ICU nurse, and I mentor pre-nursing and nursing students who are navigating their journey through nursing school. Over time, I realized that students who feel most confident during the semester usually have one thing in common. They have a system for planning their week, organizing their study topics, and keeping track of everything happening through the semester. So let's talk about what that system can look like. Step number 1, plan your week. The first thing that helps tremendously is planning your week ahead of time. At the beginning of each week, take a few minutes to review upcoming exams, assignments that are due, clinical days, study goals, and things you need to map out for that week. So when you map these things out early, you avoid the feeling of constantly reacting to deadlines instead of starting to approach your week with a clear plan. Step number 2, I want you to track what you need to study. What do I need to study this week? This is another helpful habit to keep track of the specific topics you need to review. For example, instead of saying, I need to study pharmacology, you can break it down into smaller goals like antihypertensive medications today, insulin types tomorrow, medication side effects the following day, nursing contraindications the following day. Breaking your study topics into smaller sections makes studying feel more manageable and less chaotic. Step number 3, I want you to prepare for clinicals. Clinical preparation is another area where organization becomes extremely important. Before clinical days, it's helpful to review your patient's diagnosis, medications they are receiving, possible nursing interventions. Walking into clinical with some preparation helps build confidence and reduce anxiety. And number 4, use a system that works for you. I would always say this. One thing I've noticed while mentoring nursing students is that many of them struggle to keep everything organized. That's actually one of the reasons why I created the Dear Nurse T Digital Planner. It is designed specifically for nursing students, and it includes sections for weekly planning, exam trackers, clinical preparation, study organization, and many more. The goal is to give students a simple way to keep everything in one place instead of trying to manage everything mentally. Nursing school will always require hard work and discipline, but when you have a system that helps you stay organized, the journey becomes much more manageable. Instead of feeling overwhelmed, you start to feel more in control of your schedule, and you start to see some progress in your becoming of a nurse. If you're a nursing student looking for a way to stay organized during the semester, you can check out our Dear Nurse T Digital Nursing Planner through the link in the description. And if you would like personalized guidance navigating nursing school, I also offer mentorship session for nursing students. You can find both links in the description or through the link in my bio. Thank you so much for watching, and I wish you the absolute best in your nursing school journey.